Okay, I think we're going to get started. Welcome everyone. Good afternoon. I'm Ana Diaz-Ru. I'm the Dean of the Dornsife School of Public Health. And it's my pleasure today to welcome you to our Population Health Spotlight series. And this afternoon, we're very fortunate to have with us Dr. Adrian Hollis. Dr. Hollis is an environmental toxicologist and also an environmental attorney with more than 20 years of experience working in the areas of environmental justice and public health. She started out working in toxicology in the federal system as a section chief at the Agency for Toxic Substances and Disease Registry, where she worked on developing public health assessments for Superfund sites. So she started as a true toxicologist. Later on, she taught and developed a program in environmental and occupational health at the Institute of Public Health at Florida A&M University. She then went to law school and had a number of jobs in the legal world, including being a law clerk for the New Jersey District Attorney Court and the Third Circuit Court of Appeals, and also worked as a project attorney for Earth Justice and as director of the federal policy at We Act for Environmental Justice. Most recently, she was a senior climate justice and health scientist at the Union of Concerned Scientists, where she really led efforts to partner with communities in documenting the health impacts of climate change, in particular in communities of color and other traditionally disenfranchised groups. And today she is a principal and founder of Hollis Environmental Consulting Services. And in that capacity, she provides technical assistance and expertise to many different community organizations as they work towards environmental justice with a particular focus on equity and diversity. So as you can see, she really spans from toxicology to legal issues to public health to advocacy. So she's also a very active communicator and a blogger as well, and associate editor of the Environmental Justice Journal, and also serves on several important committees, including the EPA Clean Air Act Advisory Council, as well as the steering committee of the National Black Environmental Justice Network. So really a perfect speaker for our series. So thank you so much, Adrienne, for joining us. And the title of our talk is terrific, The Syndemic, Race-Based Issues at the Intersection of Climate and Health. So thank you so much for joining us. And before I turn it over to you, just a reminder to our audience that to please enter your questions as we go along in the Q&A at any time, and then I will read them to Adrienne, and we'll have plenty of time for a conversation at the end. So thank you so much, Adrienne, and welcome.
Thank you so much. Let me share my screen here, and we can get started. All right, so all of those things, I was like, who is that person? But you know, I'm very happy to be here, and it is a privilege to speak on these topics, these very timely topics. First, thank you to Drexel's Dornsife School of Public Health, and particularly shout out to Diana for her patience with me as I navigated a number of family emergencies and losses, both related to COVID and as a result of other health conditions. So as I said, I'm excited to be a part of this speaker series, and particularly to kick it off for this year, because this topic is near and dear to my heart, climate justice and health. And I believe that education and more attention to this work is very much needed. Now, personally, I work at the intersection of these issues, and so that's what I'll be discussing today. So I work at the intersection of environmental justice with a focus a little bit on environmental racism and also climate change, and then health. And so I'll be touching on all of those, and I'm open to any questions related to that because I won't be able to go into as much detail as I would like. So I spoke with students this morning and gave them a little brief history on how I became involved in this process, and it stemmed from just some childhood environmental justice issues that I experienced growing up in Mobile, Alabama, and I won't go into too much detail on that because I know you want to get to the heart of the matter. So I wanted to talk about race and place first, and you know, I always say that to talk about public health or climate change, we have to talk about environmental justice. And to do that, we've got to acknowledge first the role that systemic racism plays and has played on our communities, right? Particularly for people of color, and it has a huge connection to what we do today. So we've got to acknowledge that, and that systemic racism against Black, Brown, and Indigenous people affect every aspect of our lives, from education to employment, from housing to healthcare, and from the food we eat and the water we drink to the air we breathe. So it pretty much impacts every aspect of our lives. And just to give a reminder, as if we could ever forget, I'm not going to say much about slavery, but I have to recognize, and we have to recognize, that the practice of slavery was one of the first introductions to racism, where people were seen as a possession, as stock or property. And of course, with our Indigenous brothers and sisters, or Native Americans, you know, that was, of course, the first in this country. But simply based on the color of their skin, people were devalued. So I'm using this map simply to show you areas where slavery was more pronounced. And although people thought it was just in the South, you can see that it extends, slavery extends upwards, you know, through Maine and New Hampshire and also out west. What I want to focus you on is that the majority of activity around the slave trade happened in the South, Southeast. And I want you to remember this map and the distribution, because it correlates well with some of the other issues I'll be discussing. So I'm actually from Alabama, right down here in the heart of the deep South, and where you see the darker brown, I guess tan, is where, of course, the majority of slavery occurred. And this is also where, if you look at a map, this is a map from when I was at Union of Concerned Scientists that one of our colleagues did, just to look at the percent of Black population. And as you can see, it's very similar in distribution to the previous map on slavery activity, which is not really surprising, right? So as a part of talking about environmental racism, I have to talk a little bit about some other issues like redlining. And here in the US, communities of color, particularly Black communities, were forced to live, and we're still being forced in some way to live within certain boundaries, whether those were real or imaginary. And there were policies and systems that have existed and still exist that are designed to protect some white privilege at the expense of communities of color, including actions where local, state, and federal policy mandated segregation in the past. And that includes redlining, which was a common practice by the homeowners land, homeowners land, I just forgot the HOLC, I just forgot it just that quick. But at any rate, this is where neighborhoods in almost 240 cities across the country were mapped and color-coded based on desirability for residential use, right? And racial and ethnic demographic information was prepared along with home prices. And these areas were often, and this is just a map showing the different parts of the country, and these areas were either green for best, blue for still desirable, yellow for definitely declining, and red for hazardous. And of course, those areas correlated with the percentage of Black people who resided there. So I just had a quick map of, this happens to be New Orleans, and you can get redlining maps from all over, thanks to people who've done research in this area. So it was a racist policy because the only criteria used to assess the mortgage lender's financial risk for lending was the color of their skin. And the neighborhoods that were redlined, as you see here, they're usually the ones closer to the water, where of course later, as we saw in Boston, that became the prime real estate, right? That which was, you got that water view. But before, that was considered areas that were less desirable. And I'll tell you a little bit later on as to why those areas are less desirable even today, particularly in the face of climate change. but these neighborhoods were often deprived of public investments, right? Not just mortgages and lending in that regard, but also things that made neighborhoods desirable and nice, you know, good schools and good houses and healthy environments and of course, trees and open green spaces. And instead, these neighborhoods, and I came from one, so I know about it, were dumped on and received polluting and toxic industries, and freeways replaced their separating neighbors from each other, and then other land uses that are incompatible with leading a healthy life. And the communities that are more likely to live in areas that were previously designated as redlining are still, for the most part, inhabited by people of color. More than half of all households and neighborhoods in those neighborhoods are still there, you know, are still non-white neighborhoods, compared with less than half, about 40% of households in neighborhoods that were labeled desirable are still inhabited less frequently by people of color. And then I wanted to talk about some of the just quickly show you this map, because most of these communities lacked accessible grocery stores, for example, and leading to food insecurity and food scarcity, and or what one of my colleagues, Dr. Shakobi Wilson, refers to as food apartheid, which is very apt. And people had no choice but to make unhealthy choices in food because of the presence of you know, the lack of presence of stores in their neighborhood, but the increased presence of dollar stores and corner stores and bodegas and liquor stores. And so redlining has held many generations of people of color captive in poverty and with a very discouraging health outcome. So this is the same map of New Orleans that I showed you a minute ago, that I showed you here. But what I'm showing you here is the fact that these communities have a higher incidence of convenience stores. So sort of to support what I just said about the type of stores that are accessible to communities. Because remember, everybody doesn't have access to cars, and in some instances, before the highways were placed in these communities, there were easier methods for them to reach grocery stores. And with the placement of the highway, some of that became very challenging. And other segregation practices continued, were also included expulsive zoning, right? Where facilities that polluted the environment are intentionally sited in or near areas that were inhabited by people of color. And that was kind of guided by the NIMBY framework, which is not in my backyard. And this is a stance that was held by those living in more desirable areas, like in suburbia, where the educational system was better, as was access to healthy foods, as is access to healthy foods and greater economic wealth. So just, you know, environmental racism isn't new, right? We know all of, you know, we've heard about it for years. Not that we've made much progress in addressing it, but you know, it refers to the fact that if we control for all other factors, race is the most important determinant of who bears the burden of society's pollution, right? And if you live in an area that's majority white population, go look for the local landfill or toxic waste treatment facility. And you'll probably find that that's where the Black or Latino or other communities of color reside. And that's because, as I said, in the US, your race is the single biggest factor that determines whether you live near a hazardous waste facility. So I just wanted to touch on the root of the issue here. You know, we've talked about racism, and we've talked a little bit about siting facilities and the like. So environmental justice, I won't go into the definition, you know, the history of it and what happened in Warren County, North Carolina, but it's a social justice issue, a grassroots movement, and it seeks to protect communities of color and low-income communities from being overburdened by pollution, which is the current stance, right? And this photo is actually in a community, and I think I took this, and I'm standing near the front yard of one of my colleagues, one of my, you know, the communities that I work with, looking down the street, right? And a perfect example of environmental injustice. So just wanted to put that. I have a couple of photos that I'll be sharing. But before I do that, I talked about inequity in siting. Let me back up and say that environmental justice is equal protection, right, under the law, not equal pollution. Not that pollution should be distributed genuinely across all the U.S., but in reality, we all deserve the same right to live in a healthy, clean environment. So just keep that concept in your mind. So I wanted to share this slide with you, perhaps some data that I gathered on the locations of power plants in the United States. And as you see, a huge concentration is in that same area that I showed you that slavery was located, that African Americans were located, and then you'll see it in a couple of other slides that the same pattern continues. But here is the siting of power plants. And more than half of people who live within 2 miles of a toxic waste facility are people of color. And they're nearly twice as likely to live in a fence-lined community, and I have a photo of that to show you, near industrial facilities. And they're exposed to about 38% more outdoor pollution than their white counterpart. And in large urban areas, a low-income white person is exposed to less pollution than even the highest income Black, Asian, or Hispanic or other groups of color, which is mind-boggling. And research has shown, not my research, research in general has shown that the nearness, the proximity to a hazardous waste site correlates very well with race, which, based on what I've told you and what you already know, is really no surprise, right? And we know that Black families are more likely to live close to these facilities. We also just want to be aware of that there are currently over 1,000 Superfund sites on the national priorities list. That's the list for cleanup by the Environmental Protection Agency. And in addition, 51 sites are proposed to the list. And this is as of December the 9th of last year. So these sites, which include manufacturing, processing plants, mining sites, and landfills, are for the most part located in communities of color, which suggests that they have been written off as not necessarily valuable by the fact that these facilities are deliberately sited or located in their community. Now, this is a photo that I took when I was in Texas. And in the foreground, you see a basketball court and green space. And there's a school that you don't see right to your right as you look at it. And in the background, of course, you see a polluting facility. And this could be I say Texas, but it could be anywhere USA. And this is what we talk about, what we mean when we talk about a frontline or fence line community. If you look at this photo and look at the homes on the left and look at the fence, look at the facilities right behind the fence on the right. And can you imagine the fear that one must have living there and anticipating an accidental release or an explosion and what that looks like when you're right there? And to evacuate, you have to literally pass by this facility. So as a people, people of color contribute the least to environmental pollution, yet have the highest amount of exposure. And some of that I just wanted to touch on one of the health effects that is very prominent, and that is asthma, right? And it's strongly correlated to air pollution, of course. And according to the World Health Organization, more than 200 million people suffered from asthma in 2020. It's a common disease among children. I was telling the students earlier today about growing up in Mobile, Alabama, and how people didn't have access to the doctors as often as others. And so one of the things that parents did was hold their children over a bathtub while running the hot water, hoping that the hot water would open the airways to allow the kids to breathe, because it was often a choice between medication or food or rent or for lucky people, mortgages. That wasn't really something that everybody experienced. So I've given you an overview of environmental racism, a little bit about environmental justice, and the impacts of that. I talked briefly about asthma, but there's of course other health effects, diabetes from the lack of grocery stores, from unhealthy choices, food choices, the fact that they're sited in communities where there's no access to parks and green spaces, so people don't have the capability to go out and exercise as freely as other communities do. I want to even get into the fact that, about bike paths, because even where I live right now, there are no really accessible bike paths in my community here in Maryland. But you see incidences of cardiovascular disease and mental health issues and just so many diseases that we are now familiar with because it's been designated as pre-existing conditions in the face of COVID-19, which I'll also talk about briefly. So, but before I do that, let me just talk about climate change. So climate change is real, we know that, right? And we're causing it, humans are causing it. It adds enormous amount of greenhouse gases to what is already naturally occurring in the atmosphere, and therefore increases what we know as the greenhouse gas effect, the greenhouse effect and global warming. And we need to focus on ways to reduce emissions, reduce greenhouse gas release, and reduce exposure for our communities so that they can be not only resilient, but actually better, right? Not just from climate change, but from all of the historic practices that have relegated them to what is considered by others to be less than, but it in reality is not. So climate change, as we know, impacts the air we breathe by increasing the risk that air pollution, including ozone and particulate pollution, which I'll discuss a little bit more in a minute, will worsen. And as temperatures increase, we see more ground level ozone, sometimes called smog, for those who are more familiar with that term, which is a powerful air pollutant. And then ozone and particulates, methane pollution, fine particles, diesel exhaust, and other hazardous air pollutants can cause cancer and affect birth outcomes, premature labor and delivery, or stillborn babies and things of that nature, right? And neurological problems, and just affect so many aspects of what we consider to be a healthy life for the most part. So for the communities that I work with and partner with, and other communities, climate change is what we call a threat multiplier. Now, I was corrected when I used this term the first time because, I know that the term was coined initially in terms of climate and weather, but for communities, yeah, it definitely multiplies the challenges that they are already facing by the conditions that I've just briefly described to you. And it exacerbates existing conditions and leads to worse scenarios. And I'll talk a little bit more about that in just a minute. Briefly, I wanted to just to show you or go over with you some of the social and economic impacts of climate change and point to a few, which includes fresh water, which will be or is already in short supply in some areas, and there's going to be, we expect more wars to gain access to limited resources, as well as loss of the capacity to work because of increased heat. The heat is it's going to get hotter, y'all, before things regulate it, particularly if we keep doing nothing or less than we need to be doing. And then relocating whole towns. And this is just for the general population. This is exacerbated 100 times more. I'm using that number, but just to show you, it's worse in communities of color that already are facing challenges, right? Just for example, the issue of relocation. Communities, a lot of, I said this earlier today too, we all hold community relationships, close to our heart, very dearly. Everybody, when I grew up, everybody knew everybody. And the neighborhood really did help raise you, to the detriment, to your detriment. If you were caught doing something you shouldn't have been doing, the word reached my mom before I got home. So, and I was appropriately, we appropriately addressed that issue. But, when you talk about relocation, you lose that sense of community. You lose that that situation where we work together and we share challenges and help each other to address issues. So that's another big effect of climate change. Just want to also show you my next map. I want to go back and remind you of the first maps that I showed you. This is a map of counties. This is also from the Union of Concerned Scientists in their report on extreme heat. When we talk about more public health risks, right, for people and communities across the nation, minorities are especially at risk. And I'm focusing here, but this isn't the only place, right? This is just near and dear to my heart because that's where I'm from. And that's where I have family still, although I do have family in other parts of the country too, in case they're listening. I don't want them to become upset with me. So, but if you just looked at this, historically, traditionally, in these communities, you might see about 5 days with a heat index of greater than 105, right? But if we don't make changes when it comes to addressing climate change, we're going to be adding on more than a month and a half of days where the temperature in our environmental justice communities is going to be over 105, and that's in orange. I neglected to say that. And the counties with less than 25% African Americans, that's in gray. You'll see that traditionally historically they may have had about 2 days a year with a heat index greater than 105. And by mid-century, if we don't do anything, it's going to be almost an additional month of heat, extreme heat days. And that's very concerning. And here's just another way to look at that. Historically, you still see that there were issues in the South, but when we go to mid-century, of course, that increases. It's deeper in the South, and of course, late century, it's just most of half of the country, and this is a big issue that we need to consider. Right, so that's one of the effects of climate change. We also have to acknowledge that systemic racism has affected us in so many different ways. When I talk about location and place-based issues, we as a people live in areas that are more at risk from the effects of climate change. Why is that? We're from the bottom and from the areas that are where flooding normally occurs, right? That are in some instances below sea level. And can you imagine the toll that takes having to, you lose everything over and over again. You're forced to evacuate and leave things behind if you can afford to do that. In a lot of instances, we can't afford to do that. Everyone can't afford to do that. So, just thinking about that and place and the fact that we see more sea level rise and chronic flooding now. And so what was once a very rare event is now the norm for a lot of communities when it comes to just flooding. And if you just look in the background of that, off to the right, and you see these flooded homes. And for those of you who were able to go to New Orleans after Hurricane Katrina to hopefully help, with the conditions that were ongoing there, I know I did, and the water levels were above the window, like sometimes up to the roof. And those are things that we don't think about, but it happens for some people daily. So I just wanted to put that reminder in there. Now I wanted to quickly talk about urban heat islands. And this is from another study at the Union of Concerned Scientists by one of my colleagues, Dr. Juan de Clet Barrito, who focused on micro-urban heat islands and the difference in the amount of vegetation like tree cover and heat retaining materials like asphalt, concrete, sidewalks, cement, buildings that are made of concrete that are heat absorbing, and then areas that have more homes and more trees. And that's what you see here. These two, the diagram on our left, which is mostly yellow and red, is a community that happens to be a Spanish-speaking community and low-income area. And what you see is that it's hotter than the area on the right, as shown by the blue. And they're only 3 miles apart. But the one on the right has more tree cover and less less ability to retain and absorb heat. So it's cooler, and it's just 3 miles. And this is all over the country, right? And this affects your health also. When I say you don't have tree cover, what I mean is you can't walk to the park to escape the heat. And then just to jump ahead a little bit about COVID and how that affects areas that have urban heat islands. Well, then the issue becomes, what do I do when it's so hot in my house and I can't, hypothetically, can't afford to pay my electric bill because I know I'm going to want to run the air conditioner more, right? So we go outside at night and we sit on the stoop. What does that look like in the face of COVID-19? Well, issues around social distancing have to go out of the window, because you're outside and you're talking to your neighbors, you're trying to, I don't know, catch a breeze, as they say, or as we say, or just escape the heat of your apartment. And so that's an extra challenge, right? Trying to maintain some sort of safe perspective in the face of climate change, or on top of environmental racist practices. And in addition, what if you were evacuating, right? And you had to stay in place, not evacuate, you had to stay in place, and you had to, as they did in Lake Charles, if you recall the big fire, this was after, I think it was Hurricane Maria, but I'm not sure, that people were told to shelter in place, close your windows and doors, don't turn on your air conditioner. And it was a very hot day, not to mention COVID. So you may be in a place that wasn't prepared to deal with people who may or may not have been exposed to COVID, but you had to stay there and shelter in place. You didn't have access to air that's circulating to help decrease the opportunity for infection. So we never think about these things, but we must start, because everything that affects the communities that I'm talking about is going to affect everyone. And we also, heard about the wildfires, and we knew about the wildfires out west, and we know that that's still occurring. But what everybody doesn't know is that in some instances, migrant farm workers were still working as the wildfires raged. And that's crazy, because what they were doing was being exposed to all sorts of air pollution, including particulate matter, or PM, right? And of course, the focus from most science lately has been PM 2.5, which is PM with 2.5 microns that you really can't see with the naked eye. But the importance between that and COVID sort of came to light last year, when the premise was that people who were exposed to more air pollution and more particulate matter had more cases of COVID, because the virus would sort of hitch a ride on the particulate matter, if you will, and thereby be able to travel down into the deep recesses of the lung. So that, of course, follows that people who are living in areas that cause them to be exposed to more pollution are more at risk from infections or opportunistic infections. And that doesn't necessarily end at COVID, right? That's just what we know right now. So something else to keep in mind. So I'm going to switch a little bit before I end this presentation, and talk a little bit about the impact of climate change on human health. And a lot of us have already seen this particular fantastic, I love this diagram from the Centers for Disease Control and Prevention on climate and health. So this kind of talks a little bit, shows us some of the impacts of climate change. I'm not going to focus on all of them, but I do want to talk a little bit about, to point out extreme heat and heat-related illness and death, including heart attack, and environmental degradation, right? So that leads to forced migration and civil conflict, and mental health impacts. And I talked a little bit about that, the stress that occurs when you have to evacuate the only place you've ever lived, or because of safety reasons or health reasons or lack of access to resources that most of us consider, don't even think about. So, when we think about all of these impacts, and you can, just find the diagram, think about it in terms of people who are already exposed to, who are already experiencing some of these because they live in environmental injustice communities, right? Or what we call environmental justice communities. But when we talk about, I mentioned this already a little bit about COVID-19, I wanted to kind of point out this is from 2020, March to June 2020. to look at the last three bars, the Latinx and Black and Native American and Alaska Natives, and the rates of COVID-19 hospitalization compared to white and Asian and Pacific Islander, which, you know, that data may be debatable. But, you know, the evacuees that I talked about a minute ago, if they did contract COVID-19, they face steep odds, right, to recovery. You know, that includes includes things like access to health care, which is also a challenge for a lot of people. And it was a challenge for people in my community growing up. So this is something that we saw that was observed during COVID-19. And this is another slide from the Center from CDC. And then this slide talks about something we already are aware of, and that's unemployment. And this was also in 2020, but we see it today. The employment for Black and Spanish-speaking populations and other people of color fell by 16 and between 16 and 18% just from February to May of 2020. And it still hasn't really bounced back. And a lot of people aren't earning an income. So evacuating, as I think I mentioned earlier, is expensive. You have to buy gas, you have to pay for hotels, you have to eat your meal on the road. You may have sharing a room with 4 or 5 or 6 other people, non-family members, who you haven't been quarantining with, right? Or you know, so your risk of infection has tripled. And a lot of people still have not returned to work. But think about this: if you can make more money on from unemployment than you did from working a job, would you go back to work? You know, and so this is all about giving people a livable wage, you know, a realistically livable wage, so they can afford to, you know, to start generating generational wealth and things of that nature. They can afford food, healthy food, and medical assistance and the like. And we've seen across the USA where businesses have had to close and people have become unemployed because of businesses had to close, and people with the lowest income still working during the beginning of the pandemic, and even now, which I consider we should be thinking about shutting down some businesses, right? People working as frontline workers and essential workers in restaurants and hotels and entertainment venues, and they've lost the most during the COVID-19 recession. We can complain about having to work from home or even having to go into the office, but these people, you know, a lot of us, including my brother, you know, they didn't have anywhere to go. They lost their jobs and they weren't getting compensation for that. People are still at risk of eviction and foreclosure and bankruptcy. So everything that I've described to you is what we call, you know, the syndemic, right? And it's usually a set of linked health problems that interact and compound each other's effects. And we talked about structural racism. I've spoken about environmental injustice and climate change. And then I added COVID-19. I said 2 or more, we only needed 2. And the thing about it, even without climate change and COVID, communities of color and poor people have been dealing with the syndemic. We didn't call it that, but have been dealing with that for years, you know, for many years. And any one of these on their own is deadly, but together it's, you know, unimaginable. And, you know, in addition to that, people are facing wildfires and floodwaters rising and hurricanes and incomes that are cratering and infections, as we've seen with both the Delta variant and across the Omicron variant and the new variant, which has not reached this country. We've seen evictions and foreclosures increase, along with the increase in the number of homeless people. And people's despair has grown and mental health issues have grown. And all of this makes us endemic. I don't even know what the word is, because this is like a super syndemic that, you know, that we're in now. And so when we talk about addressing these issues, and, you know, there's always good news, right? Those most affected by these compounded risks know best what they need to live safe and healthy lives, right? For example, there's a community in Mississippi, Sand Branch, Mississippi, that has never had running water. And 30 years ago, they relied on well water until the wells became contaminated. And to this day, as far as I know, they still aren't on city water, right? And they've depended on volunteers to donate water for cooking and other uses. Well, there are so many sand branches all over the country, all over the world. And one of the communities that I'd like to sort of lift up in addressing issues around water quality is in Florence, South Carolina. It's with Kingdom Living Temple and Reverend Leo Woodbury. They're working with a group to look at using solar hydro panels to pull water out of the air. And then no, it doesn't have to be raining or foggy. It's just using what nature has given us, and then bottling that, and then having that so that you won't have instances when there's extreme weather and you don't have access to water. So you won't have another Flint, Michigan, which, by the way, people are still waiting for clean water. Although, if I'm not mistaken, they're still paying that water bill, which is totally crazy to me. And issues that we've seen in New Jersey and other places, and issues where water, people who work for the water department have been falsifying data because the water may be contaminated. So communities have taken it upon themselves all over the country to address some of these issues instead of waiting for something to be done for them. They recognize the problem, they know what they need, and they've been sort of leading the drive. If we let them lead the way to source of changes that they need to see. We talk about this with the traditional ecological knowledge that we see with our indigenous brothers and sisters, and the fact that people have experience with dealing with these issues, and we aren't tapping into that enough. And we need to start thinking about that. I mean, think about it. Climate change is the biggest threat to human health. Climate events disproportionately impact Black, Indigenous, and communities of color, as well as the poor, and intensifies the adverse effects of environmental contamination that we've seen on the physical and mental health and well-being of people who have to deal with this on a daily basis. And the resulting disadvantages are due to conditions like environmental contamination and air pollution and poor water quality. And it's not a coincidence that this has happened. That stems from racism and racist practices. A foundation built on inequity and inequality and exclusion that was created a long time ago and based on a perceived racial, class, or gender social order that really doesn't exist. And until structures like economic and energy and electoral injustices are dismantled, and this is from the words of one of my colleagues, that we as a society will not thrive, and we won't. Our communities won't thrive, and we want more than just survival, right? We want people to be not just resilient, but to actually not even have to deal with some of these issues, just as other communities don't have to deal with them. And so on that note, I want to leave with you a charge to figure out your role in this and what you should be doing and what you could be doing and what you are doing that may exacerbate conditions, and see determine what changes you can, that you can make. And on that note, I will end here, and thank you very much. I'm open to questions.
Thank you so much, Adrienne. That was terrific. I think you can hear the virtual clapping. This is one of the downsides of these webinars, that you can't see the 100 people that we have listening, but we're all clapping. So thank you so much.
Thank you.
We already have a number of questions, so I'm going to start the conversation. Everyone, feel free to add any more questions or comments to the Q&A. So the first question is from Chanel Jones, who asks, a lot of people in my community think of environmental issues as a rich people, non-people of color problem. But it's obviously something that affects us all. And historically, certain communities are affected even worse, redlining, brownfields, et cetera, as you described. What ways do you find work to get certain less interested but highly affected communities interested in joining efforts to fight and protect the environment and their communities?
Well, let me, if I'm understanding this correctly, and thank you for the question, Chanel. I it's environmental issues. I'm surprised that you would say that rich people, non-people of color, think of it as that is their problem, because it's I think that may be the case now that environmental issues have sort of traversed the invisible line, right? The invisible race class line. But it's been a problem for our communities of color and poor people for since the beginning. And so I always say people want to know three things. How is it? What is it? How does it affect me? And what can I do about it? And I think that applies across the board. And so what I suggest, and I don't have all the answers. I know some people who might have a few answers. Is that we work together, partner together. All of the people you describe and the people that I've been describing, everybody, small businesses, we're all stakeholders, and all stakeholders need to be at the table working together to address the issues. And I think that's the only way that we're going to start making change. And I think once people realize, and maybe what you're saying is that they are realizing that it does affect them, that we're going to see a lot of involvement. And other than that, I think, for those who don't want, and you didn't ask this really, who don't want to get involved because they don't think of it as an issue that affects them, we don't have time anymore to spend trying to convince them. We've got to move forward and, onward and make change. So, it's sort of like, get on the bus or catch another ride or something like that. But I think that partnership and letting communities lead, and people have fantastic ideas, and we just need to listen to them. And I think that we haven't been doing that. So hopefully that answers your question.
We have another question from Richard Trin, who was actually a student of yours. So he says hello. So he asks whether there are any efforts that the federal government is undertaking to address environmental racism, or is this more of or environmental justice efforts more delegated to state and local governments? Do you have any thoughts on the role of the federal government versus state and local?
Well, I do. And hey, Richard, I think that everybody, has a role. Every, government organization, state organization, local organization has a role to play. And what we see with this administration, we see that, environmental justice has become a big part of the work that they're doing, right? The Justice 40 initiative and other issues around addressing people of color. We see a lot of, not enough, philanthropic organizations jumping in and providing some funding, which has all traditionally been a problem, right? Lack of resources. But at the government, I think at the federal government, there's so much to be done. And I feel like based on what I sort of have been following, a lot of federal agencies are mandated, and some on their own have made a decision to make addressing environmental justice a big part of the work that they do. So there is hope there. And that has not traditionally been the case, but things can change and have changed for the better. So
we have another question from Jerry Fagliano, who's chair of environmental and occupational health at our school. He asks if you would comment on what, to your knowledge, what are advocacy organizations doing to overcome the policy stalemate in Congress on climate change? Or, and this is related to the prior question, if policy advocacy at the state level is more promising, at least in some states, will it be enough? Do you have
that's a hard
one,
yeah, because I'm not a, I'm not a political wonk, but I can say that advocacy organizations that I am familiar with are working to address this issue, right? They're working to ensure that policy addresses all of the people who are disproportionately affected by climate change. And they're working hand in hand with legislators on the Hill in a lot of instances to address this. So I think that it is, again, there's a lot of work to be done, but I feel like, you know, the organizations are really being heard. I'm smiling because I just know, I'm thinking about the fact that a lot of organizations have really started to capture the attention of the public and also of people in government, and that's a plus. And so I think that they've sort of taken on this mantle of pick up the mantle and started really vocal, being more vocal about the issues that they're facing, that we're all facing. So hope that answers your question.
Yeah. So I have a question that's a little bit of a follow-up to that. You know, as you described, there are multiple ways in which the climate crisis intersects with, equity issues. One is disadvantaged communities and minoritized groups are more exposed to the effects of climate change. They're more vulnerable to the effects as well. And also, I think one big danger is that the things that we do to mitigate climate change or to adapt could also increase inequities, because we're not really thinking about the implications, right? And you and I were talking a little bit about before the talk about the COP meeting, which, for those who don't know, is this sort of United Nations Conference on Climate Change, which happens every year. And Adrienne was telling me she was there in Glasgow just last fall, or whenever it was.
November.
and so I was wondering if you could share, your reflections on to what extent these issues of equity and environmental justice are percolating into these discussions that are happening globally about what to do about climate change.
Yeah. And,
do you have any?
I'm sorry.
Yeah, if you have any thoughts on that.
Oh gosh, I have thoughts on everything. I the discussions that I heard, and as I said, I was telling the dean that I didn't get inside the gates, as I call it, until the second week, and that was thanks to U.S. Climate Action Network for getting me a pass. But most of the action and around equity and justice and fairness and inclusion was outside the gates, right? It was with the young people, and also not just the young people, but the advocates and activists, and they were talking about it and bringing it to the forefront and talking about it to the media and things of that nature. And I felt like that was the movement that I saw at COP. That was the most important part of what I saw. And even when I did get to enter the gates, I went to I didn't so much as go to the delegate meetings as I did to the pavilion where the, everybody else was, right? And there were some fantastic discussions around health and equity and fairness and environmental justice, and not enough, and hopefully that'll change with the next meeting in Egypt. But I know that some representatives from the White House's EJ Advisory Council spoke about environmental justice and its role. And I was looking for more about that, but there wasn't enough. And I'm hoping that it can be a major focus of not only this, the next COP, but going forward. Mm-hmm. Because it is such an important part of of climate change, of health equity, and where we are right now. So yeah, that's that was my main takeaway from COP, is that there wasn't enough. Yeah. But I did see action, and the young people were phenomenal, as were those who have been fighting, who are always outside the gates, always educating and reaching out to more people to get them involved.
Mm-hmm. Thank you. Let's see. I see three more questions, four more questions. We'll try to get through them with your help, Adrienne. And you will. So one is from Brent Langelier, who's one of our faculty. What are some priority unanswered questions, do you think, that public health or urban health or health disparities researchers need to address that are important for climate? Do you have any thoughts on that? I mean, what can the research community contribute to?
Yeah, I have a couple of things, and that's from my background as a scientist. is the need for more data. You know, when COVID was at its peak initially, myself and so many other people were calling for more data, on more exposure data, demographic data, right? Because people were saying that people of color were more affected, and some places were, provided data on that. Everybody should have provided data on that, because that would have played a bigger role, I think, in how the vaccine was rolled out. Areas where there are hot spots. And I recall somebody even saying to me, well, people say that people of color are more affected, but when you look at older people, it's white people who are more affected. And then my point was, yeah, because we don't live as long because of the other health effects. So you're looking at a demographic group that probably doesn't include as many people of color because they died, right? From just the environmental challenges, not even talking about COVID. I'm just talking about the general environmental challenges that affect our public health. So I think questions around data and gathering data and making that data available for community scientists to use, right, is very important. And I think there was a second part to that question that I didn't address.
I think you answered it. Yeah, thank you. There's another question also related to role of research from Usama Bilal, another faculty member. Over the past few years, I've seen an emerging trend of asking for even further proof of causality in environmental health studies in order to justify, regulation. Some of these efforts end up limiting regulations. How do we balance scientific rigor and protecting population health? That's also a big question. Do you have in your experience?
Well, I always talk about the precautionary principle, right? And the fact that people are always asking for data, that's a challenge that communities have faced from the beginning. Yeah. Like, just community science, and this data isn't rigorous. There isn't enough data. Even though everybody on your street, 45 people died from cancer, that doesn't mean that there's a causal relationship between that and the contamination from the site that's located at the end of the street. Things like that. And so I'm at the point where we have to move beyond that, and just keep putting the data out there and gathering more data. But the best way to do that is with partnership with the communities, right? That community-based participatory research model that we used when I was working in academia, and that we're using now, and it's where communities lead. And we don't come to them with questions that we already have formulated processes for and answers for, but we talk about what's important and what the issues are, and identify areas where we can work together. And I think that's what's important, and that's the role of research, is to provide that support and in that support community science, and to address these data gaps, EJ analyses and other issues that have been lacking, cumulative exposure, cumulative impacts, all of those sorts of things. So there's so much to do. And we just have to remember that we can't do it alone. We can't do it in our proverbial ivory towers, right? We've got to do it in partnership with communities. And by partnership, I mean partnership down to the budget level, that we provide funds to communities also, not $1,000 here out of a $10 million budget, but actual, partnerships. So,
yeah, fortunately, I mean, there's been, at least we have countered the tendency that there was during the prior administration at EPA in particular, in terms of restricting even the kind of data that could be used in drawing conclusions about, health impact. Basically, observational studies were pretty much being discounted almost completely, which is like, so fortunately, we're moving back to something a bit more sensible there, but it's an ongoing challenge. I see a couple more questions. One is a question about, what actions we should be taking. In particular, the question says, given the challenges of what we expect to happen with climate change, should we be moving certain communities, for example, Black and Brown communities near sea level, to higher ground, or should we be leaving them in place and adapting and, building seawalls or stilts, the questioner asks. This is a really challenging issue. Do you have any?
I'm sorry, it is, and that's a great question. And the first thing I'm going to say is that whatever we do, we need to do it with the community, and they're going to decide. Relocating is hard for just some of the reasons I mentioned earlier. So it's got to be something that's undertaken as, in most instances, a last ditch effort, right? Because people don't want to relocate. I mean, but one thing, they don't have the wherewithal to do that, the financial wherewithal to do that. And I think that any decision, I can't, and none of us can or should say what should happen to these communities. We should ask what should happen to these communities by asking them, right? And then if we present the data that we have and the information, what we know, that's the three questions, right? How does it affect me and what can I do about it? We present all of the issues and then together decide on the best course of action. And the issue to date with like putting, raising residences, right, is that one, let's just say it's required in order to get insurance, flood insurance, you have to raise your home 10 feet. Well, guess what? Everybody can't afford to do that. So what does that mean? That means the next extreme weather event, and they get flooded again, they have no coverage because they couldn't afford to raise their home. So there's so many ramifications for a lot of the actions that, and you said this earlier, there's so many things that are both positive and negative that we've got to talk about it and agree together on, identifying some next steps together.
There's another question from Mariana Chilton, another one of our faculty members, and she thanks you for a great talk. And says, understanding that government interventions and protections are inadequate and unmoving despite the catastrophe upon us, do you have any insight on how the concepts of the rights of nature or community rights or indigenous human rights can assist with engaging communities in protecting their ecosystems?
Yes, and I think I talked about this a little bit. So that's a fantastic question. It's we have to recognize and understand the value of traditional knowledge, and when it comes to issues around dealing with nature events and like wildfires and people have dealt with that in the past. And what did they do? Were there prescribed burns, or there have been instances where our communities have used traditional methods to address these issues, and we need to know what those are and you start learning that and applying it, right? This is all part of that partnership and sharing information. And one of my other colleagues' friends said, the communities recognize that the cavalry isn't coming. Like, we're the cavalry. We have to save ourselves and each other, right? And part of that includes most definitely traditional knowledge and working with, learning from community groups and indigenous groups and everybody like that, learning what they've done in the past and exchanging information and exchanging science. And part of that, of course, is recognizing that community science is just as important, if not more, in some instances, than laboratory-based science, right? And so I guess my theme throughout is just the importance of partnerships.
Yeah, along those lines, there's another question about what do you think, what can folks do locally? Do you have any, this is a common question. Is there something, we have to change the system, change the big picture. There are lots, but are there things that we can do locally? How can do you have any thoughts on that?
That's, you make it seem like I'm very opinionated because I have thoughts on all of this, and there's and Monday is a fantastic day to look into this, to deal with voter issues. But even things so much as ensuring, one, that people retain the right to vote and that it becomes accessible to everyone, but also, who are you voting for? Right? Because if they're not saying things that you want to hear, and my colleague Mustafa Santiago Ali said this more. If they're not saying things that you need to hear that are going to benefit you, those are not people you want to have in office. And I'm paraphrasing him on that, and it's true, right? The people you elect are people to represent you. You better look and make sure that those are the people who have your best interests at heart. And I don't mean economic, putting money in your pocket. I'm talking about putting people over profit, right? And even becoming involved in community groups, community, become a community activist or advocate, or even something as simple as calling, writing your representative, state, local, federal representative on issues. And so the first step, the easiest thing, is to become involved in an organization, and chances are very good that there's one in or near your, where you live. Of course, you might have others, so.
Thank you. Yes, we have I think we're almost at the end of our time, and I don't want to. We've been bombarding Adrienne with lots of questions because there's so much interest in hearing your thoughts on these topics. Just a couple of last comments I see in the Q&A. Really try to think about, well, what are some positive examples that we can share? Are there success stories? One commenter, Diane Dillon Ridgely, also says about going back to our COP conversation, saying, yeah, that's true, but there has been some progress, and have been efforts to build a global coalition around these issues, and we have to. There's the long view. We have to keep working on that. But just to close, are there any reflections on success stories or things that you want to share?
First of all, hi, Diane. I know her, and she's correct, and I didn't talk about that. I did this morning with the students that one of the exciting things was the fact that the United States had decided to join the health movement that was occurring at the COP. And I mean, they've been involved. We've all been in, well, not me, because this was my first COP, but people have been involved for years outside of the COP. But this year was the first year there was actually a health pavilion. And so we could start talking about the health effects of climate change. So, and then even with that, so I totally agree with you, Diane, that things have come such a long way. Of course, there's always a long way to go. And so we don't want to sit on our laurels, but we've got to give acknowledgement to success stories. And there's been successes. Communities have been a part of legislation that has been designed to protect them, incorporate environmental justice, and that has occurred in places like Illinois and in Virginia and other places. And there are a lot of stories, success stories that we have. But what I'd like to focus on is that we don't know enough. There are probably more. We just don't know, and we need to know. So there should be an avenue where we can talk about the successes so that others can learn from that and take that and move forward in their community or in their neighborhood or at the federal level, state and local level. So I do believe, and I feel in my heart, much like what I talked about with Reverend Woodbury, is that there are success stories of people just really making progress. I mean, we're a success story, right? Just the fact that environmental justice is so big with this administration is a tribute to those who've been working on this issue for years. And yes, that includes you, Diane, and others, and to get where we are today, even though we're not anywhere near where we need to be, we're a different place than we were before. So I do wish that there was like a place we could sort of a resource hub where we could all share stories, success stories, and just have those at the ready, and also just let communities talk more about their successes and provide those opportunities too. So I'm very big on that. So that was a good point. Thank you, Diane.
Yes, and I think, as you noted, the fact that health has taken such a prominent place now, this last COP was the first time that health was really linked to climate in a very explicit way at these conversations. So I think there's a big role for us in public health to play in continuing to move that agenda forward and connecting it to the equity piece. So thank you so much, Adrienne.
Thank you so much for having me.
And we hope to continue this conversation and this work. And And thank you so much for joining us.
Thank
and for
you.
So much time with us.
And thanks everyone for attending.
Thanks everyone for joining and for your great questions and comments. And please join us at our next Population Health Spotlight talk as well. So thank you very much. Bye.